Good day everyone! Today we will be discussing bioethics and some of the basic and major principles under it. But before we proceed to the discussion proper, let's first define bioethics. Bioethics is derived from the Greek word bios or life and ethos means ethics or behavior. The bios in bioethics represent human life where humans are the only rational creatures on earth suitable to be a moral agent. At the same time, ethos or ethic is defined as the branch of philosophy that deals with the morality of human conduct, while the quality of human act is named as morality. Thus, in the Philippines, we define bioethics as a discipline inclined to study the morality of human behavior concerning health and life. Under this concept are the four basic and four major bioethical principles. The following principles were relevant, particularly with the emergence of scientific creations, wherein several novel medical interventions may vandalize the sanctity of life and the integrity of its essence. And among the four basic and four major bioethical principles, we will discuss the totality principle for the basic bioethical and the principle of beneficence for the major bioethical principles in this video.
The totality principle states that the parts of the physical entity, including internal organs, and each part of the body must be prioritized, wherein these human body parts are meant to exist and function for the good of the whole body and are naturally subordinated to the good of the whole body. It is the classic criterion in dealing concerns with bioethical issues like mutilation, organ donation, and transplantation while ensuring the sanctity of life. Moreover, the underlying moral teachings can be reduced by asking permission through informed consent from the donor, expecting the risk in organ donation as an act of charity to be proportionate to the good resulting from the recipient, ensuring anatomical integrity wherein it does not diminish the functional integrity of a person, and making sure that a serious need that can be only satisfied by an organ donation.
In a medically related scenario, let's pretend that one of your limbs, say your leg for instance, gets a severe infection, the kind that requires an amputation to prevent the infection from spreading to other portions of your body, causing more injury or even death if left untreated. In this case, totality principle may be applied and is justified. In other words, mutilation is ethical and acceptable in this circumstance since the removal of one part contributes to the overall health and well-being of your entire body. Furthermore, using the totality principle, it is ethical and justified for you to partake in cases of organ and blood transplantation and donation as long as you, the donor, has given informed consent and is fully willing to donate or sacrifice a part of her body that will cause no significant harm when removed, in order to help the total well-being of another person or your loved ones.
Another major principle of bioethics is the principle of beneficence, and according to Stanford Encyclopedia of Philosophy 2019, the concept of beneficence connotes to attribute of altruism. Henceforth, in the medical field, the principle of beneficence requires the physician or the medical practitioner to perform in a way that promotes patients' welfare. The principle of beneficence is a moral duty and an obligation of a physician to promote well-being and to promote the course of action according to the patient's best interests. In other terms, the practitioner must do good for the benefit of the patient. Correspondingly, keep in mind that in the concept of the principle of beneficence, the term good does not only refer to what is medically right, but also what is righteous and moral to the human being of the patient.
Now, as for the principle of beneficence, a prime example would be newborn screening, wherein these are a set of specialized tests for 1 to 2-day-old infants to check if the infant has any major health concerns or disorders that does not give any sign before or during the moment of birth. Specialized tests that are included revolve around the check blood and heart screening to check for abnormalities before the infant leaves the hospital. Another example would be during an untimely accident of a senior citizen, wherein he or she may have suffered an arm and leg injury that needs to be operated immediately as the best course of action that will benefit the patient the most to prevent any more injuries. Although principle of beneficence often collides with the principle of respect for autonomy, wherein an example would be Also, during the events of newborn screening. Due to the screening being beneficial to the baby, however, the parents can use the right of autonomy to reject the screen. This situation clashes both principles, and in this case, choosing the next best course of action will be done in which the parents will be happy to comply. This can be the same with the previous example wherein if the patient disagrees with the operation, choosing another action shall be done that best suits the patient's interests.